Hello dear doctors, here we are going to explain another question about cardiology. A 51-year-old female presents with a complaint of increasing breathlessness and dyspnea on exertion. She has been having difficulty sleeping lately and she says that she has to use 3 pillows to sleep at night. On examination, the patient is noted to have bilateral pedal edema up to the level of her calf and widespread crepitations bilaterally on auscultation. Auscultation of the heart reveals a pansystolic murmur at the cardiac apex. An ECG was done, which was significant for a broad P wave. She has no medical problems other than asthma, which was diagnosed when she was 7 years old, and she had rheumatic fever when she was 14 years old. She does not drink alcohol or smoke. What is the single most likely cardiac defect that this patient has? The history of rheumatic heart disease is very important in valvular heart disease in patients. We must note this point. Okay, A. Tricuspid regurgitation. B. Aortic stenosis. C. Mitral stenosis. D. Mitral regurgitation. And E. Aortic regurgitation. And the choice according to the sign and symptoms of the patient will be left ventricular failure because of mitral regurgitation, and we will explain here. The patient has mitral regurgitation secondary to rheumatic fever. Some exam clinchers for mitral regurgitation. Previous disease that affect the mitral valve. Signs and symptoms of pulmonary edema. Pansystolic murmur at the cardiac apex in the murmur of mitral regurgitation. Pansystolic murmur at the cardiac apex is the murmur of mitral regurgitation, and chest X-ray, if given, may show an enlarged left side of their heart. Mitral regurgitation common scenarios in their exam are history of rheumatic fever, a few weeks after a myocardial infarction where patient may be admitted for pulmonary edema, and clinical features for mitral regurgitation if the patient has a left ventricular failure is dyspnea, orthopnea, and paroxysmal nocturnal dyspnea, as we can see in the patient's history and complaints. With severe and chronic mitral regurgitation, right-sided failure would eventually occur, leading to edema and ascites. An important clinical sign of mitral regurgitation will be pansystolic apical murmur radiating to the axilla. We can hear this pansystolic murmur in the apex of their heart, and the radiation is to the axilla. We also ECG signs of left ventricular hypertrophy and left atrial enlargement. For example, if the patient has left atrial enlargement, we will see broad P wave. Chest X-ray may show an enlarged left side of the heart. Diagnosis is echocardiography. This table will show some common heart murmurs. Aortic stenosis. The type of aortic stenosis murmur is ejection systolic murmur, which we can hear it in second intercostal space to the right of the sternum. And aortic stenosis symptoms is dyspnea with activity, anginal chest pain, and syncope. Aortic regurgitation is early diastolic murmur, which we can hear also in second intercostal space to the right of the sternum. And the signs of aortic regurgitation is also dyspnea with activity, anginal chest pain, and syncope, also symptoms of heart failure. Mitral stenosis, if the patient has mitral stenosis, we will hear mid-late diastolic murmur in auscultation, and their place is in the apex of the heart. The symptoms of mitral stenosis will be symptoms of heart failure and also symptoms of congestive heart failure. And mitral regurgitation is a pansystolic murmur which we can hear in the apex of the heart with symptoms of heart failure and symptoms of congestive heart failure. Pulmonary stenosis is ejection systolic murmur which we can hear in second intercostal space to the left of the sternum, and the symptoms is systemic cyanosis and symptoms of right side heart failure. And pulmonary regurgitation is an early diastolic murmur. We can hear it also in second intercostal space to the left of the sternum, and the symptoms is systemic cyanosis with symptoms of right-sided heart failure. Tricuspid stenosis. If the patient has tricuspid stenosis, the type of murmurs is diastolic rumble. Diastolic rumble, we can hear it in lower right sternal edge, and symptoms is fluttering discomfort in the neck. And if the patient has tricuspid regurgitation, we will have lower we will hear pansystolic murmur in the lower right sternal edge, and the symptoms will be fluttering discomfort in the neck and symptoms of right side heart failure. We must point this note that when the patient has different cardiac problems in the valve, in the atriums, in the valves or in ventricles, we will hear the murmur in different parts of the heart. And when the patient has aortic stenosis or aortic regurgitation, the place of the murmur is second intercostal space of the right to the right of the sternum. And when the patient has mitral stenosis or mitral regurgitation, the point of murmur will be the apex of heart. And when the patient has pulmonary stenosis or pulmonary regurgitation, the site of murmur will be second intercostal space to the left to the left of the sternum. And when the patient has tricuspid stenosis or tricuspid regurgitation, the point of the murmur will be lower right sternal edge. And we must note these points when we are reading their exam questions.